Hello everyone. Welcome to the ASEAN Students e-Exchange Program 2020. First of all, let me start by introducing ourselves. My name is Lahiro and these are my team members Yves, Humaira, Chen and Janice. And together we represent Temasek Polytechnic for the Student e-Exchange Program. For this event, our counterpart Institute of Higher Learning was UPNVY or the UPN Veterans Yogyakarta, Indonesia. A bit of a background about this campus. This is a state defense campus that was developed by the Department of Defense, and it's one of the youngest campuses in Indonesia. And the latest campus, which consists of 5 faculties, was opened by the former president of Indonesia back in 2014. So for the past several weeks, we had the great pleasure of working together with some students from UPNVY. As you can see on the screen, we worked with Zaki, Tan, Noor, Janitra and Arima, and together we discussed a lot of things about Singapore and Indonesia, as well as we got to know each other much more over the course of these couple of weeks. We spent most of our time together discussing mainly these 4 UNSDG goals and discussing what each country has done to achieve these goals, as well as obstacles faced. We also spoke about personal experiences that we can relate to these sustainable development goals, with a lot of special emphasis on how the entire COVID-19 situation is affecting the abilities of the countries to actually achieve these goals according to the set timelines. So for this e-finale, myself and my team members have decided to do what we can to raise awareness about the third UNSDG, which is good health and well-being. So we will be presenting about everything we have learned regarding Indonesia and the third UNSDG and the obstacles faced by them on their road to good health, as well as efforts taken to tackle them. So let's move on to other team members and see what they have to say.
Hi everyone, my name is Samson. I'm a Year 2 student studying in computer engineering. And today, I'll be sharing with you about Indonesia's plan for UNSDG Goal 3. For Indonesia, tuberculosis is one of those problems that Indonesia face which hinders their plan for UNSDG Goal 3. In fact, Indonesia is the third highest country with TB cases in the world. In this slide, you can see that there are 898,000 screenings of tuberculosis in total. And how are these screenings done? They are done through contact tracing, screening in a specific population, dropout follow-up, and risk factor analysis. In this slide, you can see that there are an exponential increase of tuberculosis cases in Indonesia throughout the years from 1999 to 2016 and still going onward. This slide shows how tuberculosis cases will go down in 2030, what Indonesia has planned. Business as usual projection shows that in 2030, tuberculosis cases will go down to 261,000 cases, while the intervention scenario shows that the tuberculosis cases will go down as low as 65,000 cases in 2030. One of the measures to tackle this is enhancing access and health services in all regions. Indonesia is improving a thorough healthcare services that includes health promotion, disease prevention, diagnosis, disease handling and management, rehabilitation, and palliative services. Under enhancing access and health services in all regions, is also increasing production of medicine and medical device in the country to improve access for quality pharmacy and medical device products. Indonesia will move more productively and efficiently to reduce the TB cases, and which helps to get one step closer in achieving their plan for UNSDG Goal 3. Thank you for listening.
One of the problems faced in Indonesia is the high level of tuberculosis, smoking and obesity. Tuberculosis is an infectious disease and Indonesia is the third highest country with TB cases in the world, right after India and China. TB cases could be reduced and prevented if all patients are treated, However, only 53% of the total cases are reported. Smoking. The use of tobacco in Indonesia starts at the early age of 12 to 13 years old and is dominated by males. Without a strong commitment, the percentage will continue to rise to 16% among young children. Obesity. In 2018, in every 5 Indonesian adults, 1 is obese. It is a serious public health problem in Indonesia. The percentage of obesity in adults has doubled in the past 10 years from 10.5% in 2007 to 21.8% in 2018. The obesity in Indonesia is caused by unhealthy lifestyle such as unbalanced diet. The solution introduced is strengthening community movement of healthy living. It includes creating healthy settings and environment, providing public open space and mass transportation network to promote physical activity, promoting health in all policies and regulation to apply higher tobacco tax and total ban on tobacco advertising and promotion. It also restricts food products that is high in salt, sugar, and fats, promoting innovative healthy life behavior change strategies, and increasing access to healthy food choice. Thank you.
Hello, so now I'll be talking about the maternal and child health in Indonesia. So first of all, I'm going to go through the country's background. The main causes are varied from health to socio-economic issues. Women who are married in the younger age have a higher risk of mortality during childbirth. There's still a gap in the coverage of skilled birth attendants across region. This means that there's not enough professionals to attend to mothers who are giving birth. So the lack of access to quality healthcare, especially people who are living in remote areas in Indonesia. Despite its significant reduction, as you can see from the slide, infant mortality rate in Indonesia is still the highest among ASEAN countries. Okay. And cause of infant death is now getting more complicated, which is related to the maternal health during pregnancy and the first month of postnatal care. So more than half of infant mortality actually occur in the neonatal period. So now I'll be moving on to the country's effort in improving maternal and child health, family planning, and reproductive health. So what Indonesia is doing is that they're going to be improving continuum of care for maternal, newborn, and child health in public and private health facilities. So they're going to also expand basic immunization coverage, improving nutritional status of adolescent girls and pregnant women, improving access and quality of family planning and reproductive health services, strengthening community-based maternal and child health services such as Posyandu, Polindes, and Poskesdes, and also improving the availability and competency of health workers.
My name is Jumbo. Today I'm here to talk about what was shared with us with the UPNVY students on improving disease control of Indonesia regarding to UNSDG 3. First of all, we have the CDC, which also known as Center of Disease Control and Prevention, which have helped Indonesia, collaborated with Indonesia with more than 50 years. They have provided assistance on multiple diseases to control the disease in Indonesia. So let's look at all those diseases. First, we have malaria, which is very common, with 15 million cases and 42,000 deaths per year. That was recorded in 2005. And there's tuberculosis, ranked in TB burden, followed by India and China. This is all deadly diseases, and which need to be controlled within the country. Next, we have the dengue. The dengue fever is most common within this area of Asia because the region of this area only have one single season, monsoon as we call it. It's only summer. So when this happens, there's no fall season where the winter can cool off, where the warmth will be the warmth level will be decreased during the winter season, which this will happen within this the equator region because they only have one season. Next, we have the current pandemic, which is the COVID-19. As we all know, this has been a very deadly pandemic. A lot of people have been affected and a lot have been killed during this period. So for Indonesia, they are doing quite a good job as 5,516 people are being announced confirmed cases, and so far it's only a death of 496 for the month of April. Next, we have the efforts done by the government, which has provided information on the controlling of diseases, including of public knowledge information, important information that allows the public to know, so that the public can have awareness to prevent them to spreading the virus even further and get the disease in control. So in conclusion, improving of national capacity, which they have included a lot of labs to do research on control of diseases such as COVID-19, dengue, and malaria. So as CTC, which also help in continuous finding support from other countries, also strengthening and improving laboratory biosafety and particles and biosecurity for long-term commitment. So thank you very much for your attention. Thanks everyone from Temasek Poly and collaborate with the UPNVY University student. This is a great exchange program and everyone learns a lot from every one of them. Thank you very much.